Dr. Lipkin, when you say that you're not sure whether the worst is over, what is it that you now fear? Could there be, 2021 was seen to be the year of the variants. 2020 was the year of the virus. 2021, we've had variants. We have 4 at the moment: alpha, beta, delta, which troubles large parts of the world, and gamma. Do you see more variants? Is that the fear? Do you believe that we should all continue, therefore, to mask up and be very careful when we go out?
So you've asked several questions. Let me take them one at a time. The first is, will we see more variants? Yes, there are variants already circulating that don't have names. Will they be more capable of transmission? We don't know. Delta seems to be extraordinarily well adapted to spread in humans. It is somewhere between 100 and 1,000-fold more likely to spread than some of the earliest variants that we saw. But there's another form of COVID that people don't talk about yet, which I think is going to be extraordinary in terms of its impact. And that is what we refer to as long COVID. There are a number of other ways to describe it. So these are not people who necessarily have severe acute disease. They may have only mild disease, but they remain permanently, or at least for a long period of time, crippled with cognitive dysfunction, shortness of breath, fatigue. This can represent as many as 30% of people who become infected. And these individuals, even if the virus were to magically disappear, might continue to be infected and have a huge impact on their lives and on culture for decades to come. So it's a very complicated picture. We have to think about the acute disease and the importance of preventing future pandemics. We also need to think about what it is we're going to do for these people who've experienced COVID and who are likely to be ill for several months or years to come.
Is the solution, though, purely vaccination, or is it a new form of social behavior, where even at gatherings like here at the India Today Conclave, we'll have to be conscious of social distancing, of masking, of generally maintaining high levels of hygiene? Is that now going to be the new normal?
So in the East, for many, for generations, you've had a very different approach to greeting one another. Like so, as opposed to shaking hands and transferring things like antibiotic-resistant bacteria, viruses, and so forth. Since 1918, when you go to China or you go to Japan, when people are ill, they wear masks on public conveyances and in public in general. The West has not done that. This has led to the spread not only of this coronavirus, but in earlier times, other viruses associated with respiratory disease, the most infectious of agents that we have. So at present, I think there's a triad, if you will, of things that we need to do in the future. The vaccination, as I say, is first and foremost. And when I talk about vaccines, let me also tell you that the types of vaccines that we're making now that are given by injection are more difficult to administer than oral vaccines or nasal vaccines. In addition, although they may prevent serious systemic disease, the virus going deep in the lungs, the heart, or other locations, if you have a way to prevent the virus from getting access to the body in the first place through what we call mucosal immunity, you may actually be able to prevent infection and reduce transmission in the entire population. If you look at all the viruses now the old vaccines being studied for SARS-CoV-2 by the World Health Organization, for example, 10% of them are mucosal vaccines. So I think this is another area where we need to shift. We need to think not only about virus vaccines that prevent severe disease, but also that prevent transmission. The second thing is that we need to improve our public health infrastructure. We have to be able to track and trace individuals who've been exposed so that we can adopt what we call like a ring vaccination strategy, which was what was so successful in India, right, in eradicating smallpox. So there are people who are now beginning to explore those kinds of issues. Masking, even if these masks are not what I would consider state-of-the-art masks, can also be useful. But people need to change the way they think about themselves and others and be less selfish. Think about protecting the person next to you. This is not something, particularly in the West, that we have done very well.